This is very common question in the USMLE and all the exam. So you need to be very familiar with it. So we have many kind of personality disorder. In DSM-5, there is 11 diagnoses of personality disorder. There is the odd and eccentric, which called cluster A. There is a cluster B, the dramatic and the emotionals, and the cluster C is the anxious. So today we're not going to be able to learn about all of them. I'm going to concentrate on three main personality disorder, which is the very common and the one that come in the exam all the time. And the most important one of all personality disorder is borderline. But let's start first. So there is personality disorder. Some patient might have the full spectrum of personality disorder. So we call that he had personality disorder, borderline or narcissistic or whatever. And there is personality trait. So that's mean you have some element of personality, but not the full spectrum of that personality. So you call that personality traits. It's kind of like bipolar 1 and 2. So it's like when you have real personality disorder, that's mean you have the real illness. Personality trait, that's mean you have element of that, but it's not full to make you be diagnosed with the personality disorder. So the first and most important one is borderline personality. The reason is because it's very, very common. So 2% of the US population had borderline personality. 70% of them are women. So it's very common in women. It's 10% of psychiatric outpatient and 20% of inpatient. So if you're going to do any residency in America, you're going to see a lot of these patients, especially women and some men. That's why they have a lot of question about it, because it's very, very common in that part of the world. So, about most of these patients who develop borderline personality have something in their childhood. So this is an illness that really happened in early childhood, whether it's sexual abuse, physical abuse, being exposed to trauma, or being exposed to neglect from the parents. So it's directly related to the parents. And as you know now, with the women busy at work and man doesn't have time, so we're going to see a lot of increase in personality disorder because apparently we are not taking good care of our children. So to look at personality disorder, we'll like to look at the cake. So if you want to look at the eggs in the genetic, so you have to have genetic predisposal to the personality, and we can look at the flowers, the environmental factors, and the cognition is the sugar and the milk are the cognitive processing to make a whole cake and make you called be personality disorder borderline. So as we said, it's directly related to the gene and the early attachment years. So you have neglect. So if your parent did not raise you well, did not have time for you, they spend a lot of time away from taking care of you, then you will get this illness. Trauma, like a lot of these patients has been exposed to sexual or physical trauma, poor parenting and chaotic and disorganized life. So if you see your parents fighting all the time, you might be exposed to that personality disorder. 76% report some kind of physical and sexual abuse. So it's very common with those illness. If you look at the biological, there is abnormality in the brain. We're going to look at it later on in the lectures. So the first, we just review quickly that we said our emotion are in the limbic system. And this is our frontal lobe, where it's like babysit our emotion and guide us in our feeling. And this is what we call emotional intelligent. Emotional intelligent, so you call somebody emotionally intelligent mainly when they are able to not let the emotion control their behavior. So they don't get angry easily. If they are an hour late on the lectures, if Mesa did not send them the Zoom link, they don't get angry and they don't break the computer and they don't get very upset. So this is your ability to control your emotion, because ability to control your emotion is going to define how intelligent you are and how much you are able to keep your thinking brain, this yellow one, away from the confusion or the hijacking of the emotional brain. So the problem with these borderline patient, they don't, their frontal lobe is very weak, that the emotional system quickly and immediately hijack their frontal lobe, and they are driven by emotion. Let's take the first case of personality disorder, borderline. Her name is Jordana. Jordana is a patient. She is 24 years old women who present to the ER. This is very common in the ER. So if you go to the ER in any hospital now, you will see at least one or two Jordana in each place here. In any big hospital, there is always when I am on call, there is at least two or three every week when I am on call like her. So they present to the ER with suicidal thought, wanting to overdose mainly or cutting their wrist. So Jordana came because she overdosed after a fight with her husband. She admit being very impulsive and angry all the time. This is her fourth suicidal attempts in 2 years, and she had mood instability. So this is like a typical case of borderline personality. They always come to the ER, cutting their arm or overdosing in medication after any altercation or any argument. And they are always, their mood is always ups and down, shifting from up to down. And this is like this is the 1 second. Uh, Hello, Dr. Yaqinuddin. I'm doing the lectures now. I'm doing the lectures now. So Dr. Yaqinuddin had called me and he apologized for the delay. So hopefully we'll finish the personality today, and then we'll do sleep later on. So these patient cutting their arm is the what you call the hallmark. Like when you say Dubai, you look at Burj Khalifa. When you see Egypt, you look at the pyramid. And when you see this kind of pictures, this is like the address or the module of or the hallmark of borderline personality disorder. So they always cry for help. They have fear of abandonment, and they have a lot of suicidal gesture. So whenever you see in the future this arm like this, that's mean that somebody is saying borderline personality. So this is like the emoji of borderline personality. Okay. So let's look at her infancy. Jordana, as an infant, she was very different infant. Apparently, she did not bond well with her parents. She was subject to abuse and neglect, and she had poor bonding, and which is very common in borderline personality. Her mother said when she was young, she was easily frustrated. She's angry all the time. She is very hard to comfort. She is very intense in her emotion. She's very angry at things. But her family at that time felt like she was just a baby, and you really, they don't care much about her. They said she will get over it when she grew up, and the family was told that baby usually do this and they will get over it when they grow up. Then when Jordana became a teenager, she became increasingly sullen and angry. She was very frustrated. She had a lot of impulsivity. She was engaging in many impulsive behavior. She started running away from home. She started acting out and become very frustrated with her teacher and her parents. She had a lot of anger, and she said, her mother said around when you see Jordana, you have to be very careful, and you have to walk like on eggshell because she is very, very irritable. And she is very unpredictable, so you don't know how she's going to react. So this is a hallmark of borderline. They don't know, and they don't you cannot predict their reaction. So conflict occur in her friendship. So Jordana will have a few friends, then lose them, then have another friend and lose them because they keep fighting with the friend all the time. At home, she is alone. She is very bored all the time. She accuses everybody around her that she is misunderstood and nobody able to understand her. And it's always your fault. So one of the defense mechanism in borderline, they always have what you call projection. So they project the anger on the other person. Her parents start to be concerned about her at that time, and they thought maybe this is typical adolescent behavior, but it was really personality disorder. By age 17, this is where the things will blow out of proportion. She was experiencing a lot of emotional instability. Her mood was totally unpredictable. She could switch from 1 minute to the other. She can be angry at minute and happy in another minute. She is stably unstable. So she's always unstable. She's fighting with her parents on daily basis. She usually yell and throw things at them. And she said you have to walk on eggshells around her. Jordana, like most borderline, they feel terrified when you leave them. So the main concern in borderline patient is fear of abandonment. They don't like anybody to leave them. Even they get attached to cat and dog, and if something happened to the animal, they go crazy. So they have fear of abandonment. So always they make your life miserable, but they don't want you to leave them. So this is the rage that Jordana came. And as we said, borderline is stably unstable. So they go from one chaos to the others. Their life is always miserable. And she always cut down in her arm. Cutting herself is very common in borderline because they feel lonely and bored all the time. And they said cutting their arm make them feel better. Why? The reason why cutting their arm make them feel better, or what you call self-mutilation. So somebody will probably do some tattoos on them, or they cut their arm, their face. They always try to hurt themselves because one of the hallmark of borderline is they have very low opiate in the brain. So their opiate receptor is way too much. So this is normal people in the up healthy comparison. The low down, the white one is borderline patient. They don't have enough opiate in their synapses. So when they cut on their arm and they hurt themselves, that will increase the amount of opiate. And you remember, opiate make you relax and happy. So that's why they cut on themselves to feel better. So painful stimuli will stimulate their opiate receptors and make them feel a little bit more relaxed. So it's more biological, not psychological, that when they cut on their arm and they hurt themselves. So the symptom of borderline, we have behavioral problem, impulsivity, like the binge eat. So you see borderline change in weight quickly. Like she might be 100 kilo one day and 90 or 70 kilos a week later. They keep switching because they are either eat way too much binge eating, or they stop eating at all. They spend a lot of money. They are impulsive in drug use. They don't have any value for money. So it's like manic patient. That's why you say borderline and bipolar disorder have a lot of things in common. They have very disturbed relationship, identity disturbance, chronic feeling of emptiness, constant fear of abandonment. So they are always scared that. Remember, borderline is like a child in the body of adult. So they still have that children feeling when their mother leave them. So if something happened, they cannot tolerate any stress, and they have chronic feeling of emptiness when you leave them. And they always have a stormy relationship. So always their relation with other are very chaotic and very stormy. And usually, affect dysregulation is the hallmark of borderline personality, fear of abandonment, emotional storm. All of this is a hallmark of borderline personality disorder. So, in a relation, they are like if you are married to a lady with borderline, you are very unlikely to be able to leave her or make her upset. One of my borderline patients, give you an example of that. Uh, I had a borderline patient in America, and I had her when I was resident. So I treated her as a resident. Then when I finished residency, I opened a clinic, and she came and buy a house near the clinic where is my clinic is. And then I moved to another town after 3 years, and she came and bought another house near my clinic in the other town. Few years later, I went back to my own town and my old clinic, and she went back and bought a house near my clinic. So this is how borderline feel like. They become very, very attached to the therapist and the doctor. So the doctor has to keep very, very clear boundary with him and the borderline patient, because you might be like their father or their mother. So you put yourself as a foster parent for them, and if you leave, they will get panicky and kill themselves. So that they have difficulty in separation. They cannot leave you. If they like you as a physician, they will be very attached to you, and they act like a child. So if you refuse to give them what they want, they will become very, very angry. So cognition had impaired, distorted thinking. Their thinking is either black or white. It's like a child. The child always think concrete. Concrete means either black or white. You are good or bad. They feel paranoid under stress. They are unable to recognize the consequences of their behavior. They are very suspicious, and they have difficulty holding in positive thinking. So always they think in negative way all the time. And for them, is like an orphan child. Nothing is safe for them. Always any change can make them very upset and very angry. And they use two defense mechanisms. One of them is splitting. Splitting means you are either the best doctor in the world or the worst doctor in the world. They don't have any middle ground. So you are always the best or the worst. You all or nothing. They don't have anything in the middle. And they have a projection. Projection means they always blame you for their problems. So always project on you. So they have two ego defense mechanism in borderline: splitting and projection. Their self-image is always a problem. They feel empty from inside. So this is a hallmark of borderline. The patient tell you, I أشعر بفراغ. I feel empty. I don't have anything inside me. They are deeply insecure. So that's why they like to be attached to someone, because they cannot function on their own. Deeply insecure. Identity problem. So they always change religion, like they become Muslim and Christian, and change religion all the time. They change identity. So sometimes they become homosexual, sometimes heterosexual. It's very hard for them to see what they are. Uh, self dependent on other. They will not be able to rely on themselves, and it's very hard for them to function normally or independently. uh, I remember one case. One of my patient, uh, let me just answer Dr. Nihal. Dr. Nihal, we are doing the lecture now. Thank you. I'll call you when I finish. So what happened, I will tell you about the case of one of my patients. Her name is Ali. Ali is very nice lady, one of the nicest lady you can ever be with. And she's married and had great husband, one of the best husband that any female can desire. And she's very rich. She has a lot of money, thanks God. But Ali has severe problem with feeling empty and depression. So we diagnoses are borderline trait, not fully borderline, but trait. So when we look at her childhood, Ali was unable to be with her mother because she was sick, and she was taken at that time to a different country, because at that time Saudi did not have enough medical care facilities. So she had liver problem when she was taken to Egypt, or I think Europe. They treated her, so she stayed away from her mother for like 6 7 months. And apparently her mother has a lot of kids, so she was not noticed. So like she has 7 other sibling, boys and girls, so being away was not noticed by her mother. So that's what you call the disruption in bonding, cause Ali probably to have the symptom she has, which is she feel extremely angry, extremely sad, unable to fulfill her behavior or soothe herself. She does not have. She always come crying. She stays in her bed all the time. She doesn't cook for her husband. She said the last time I cooked was 3 years ago. She doesn't take care of her husband's needs. She is not intimate with him. Uh, Her husband is just crazy about her, but she doesn't care about him at all. Even though he is nice, he is trying to shower her with gift, like he bought her a home in Riyadh and in Jeddah and in Paris, and give her like iPhone and Bentley and Mercedes, and but that doesn't mean anything for her, because she feel empty from inside. So this is the main problem with Ali. She feel empty from her inside. What she always tell me, that I really feel so deeply empty. So she compensated that by doing a lot of shopping. So she spent all of her time. She has plenty of money, so she always go buy like a new iPhone, a new Samsung, and give it away to people. She doesn't have any feeling of enjoyment, and this is due to her inability to bond with her mother. That's why you really, when you have kids, you really need to spend time bonding with them. So anhedonia is being really, really unable to enjoy anything. Like Ali have 3 houses, major houses, and everywhere she wants, a lot of money, all the cars she wants. The iPhone is from gold, and but she is not happy. She cannot enjoy anything. This is her. She's a very sweet lady, though. She is not angry. She's not irritable. She's a very sweet lady. And this is her pictures. She allowed me to put her pictures. Look at her pictures here. This is her pictures. I'm just kidding here. Just as a joke. So this is a picture of Ali. I'm just kidding. She's a real person, but I will not be able to put her pictures. So I said I'll put the Ali here. So the problem with Ali is because she was unable to bond with her uh, husband. I'm sorry, she was unable to bond with her mother. She was also unable to bond with her husband or her kids. Her kids, that she doesn't care much about them. She feels sick when somebody gets sick, but she doesn't have that real feeling. And she is always like try to reconnect with her mother. So she always try to visit her mother and try to, feel her, but it's not going to happen. I told her, don't try again, because if you don't bond with your mother at this early age, you are not going to be able to bond with her again. And that's the problem with Omani. So where's the problem in the brain? So the brain of borderline patient have abnormalities in the orbitofrontal cortex. We said the orbitofrontal cortex is the part of the brain that regulate your emotion, impure the intellectual materials. Impure is mean like marinate. So when you say I love you to somebody, it will show up on your affect and your feeling and your tone. So you don't say I love you, or you say I really love you. This tone is really where coming from the orbitofrontal cortex. Any damage to the orbitofrontal cortex will make people impulsive, distractible, and mood liability. So whether it's head injury or lack of parenting as a child, the same result. They become very impulsive, and they might be subject to addiction. They are easily addict in the future. And usually it's a mother relation that make the orbitofrontal cortex function well. So it depends on how much you bond with your mother. It's a win-win situation for the daughter and the mother when they have this. So any disturb in the attachment or head injury will affect that orbitofrontal cortex, making you very impulsive and very agitated. It also make you recognize other people's feelings. So we did not have a lectures on ADHD this year, But orbitofrontal cortex is a part of the brain that make you connect with other people. So, for example, when you see somebody and you see somebody who is sad or anxious, you can realize it. The orbitofrontal cortex will make you read other people's feeling. So, one of the problem with borderline patient, they cannot read your face, so they cannot predict how you're gonna react. So they become defensive because they cannot read your facial expression, your facial feeling. Why? Because they did not bond with their mother. They did not learn it from their mother when they were infant. That is the problem with their bonding issues. If you bond with your mother as a child, you will realize the mother's facial expression will stick in your brain when she is happy or sad. You can read it easily. But if you have disturbance and bonding, then you're not going to be able to read your mother's facial expression. Remember, the mother is the first object relation. So if you could not read her face and bond with her, you're not going to be able to bond with other people or read other people's feeling and face later on in life. And the orbitofrontal cortex is not only impaired in borderline, but also the bipolar disorder, ADHD, traumatic brain injury, dementia, meningioma. There is a lot of illness where it can damage the orbitofrontal cortex and cause it to be very hypoactive. So hypoactivity in orbitofrontal cortex make you impulsive. Disinhibition, like when you drink alcohol, you remove that orbitofrontal cortex from the spectrum and you become disinhibited. So as we said, they have a lot of inability to control that emotion. So if you remember Samiha and Samiha from the first lectures, where Samiha, when she had the fight with her husband, that color stick in her mind. So here is the memory of the trauma which happened as a child. We said that the amygdala is the key part in emotional regulation, and most patients with borderline have very hyperactive amygdala. So the amygdala kind of control the frontal lobe instead of the frontal lobe controlling the amygdala. So this toy is here, the frontal lobe, and the small toy is the amygdala. So here in borderline is the opposite. The amygdala is the one in control, and the amygdala, when it's in control, is always put you in defensive place, make you very tense, make you very emotional, and it always put you in alert so you can fight that danger. Because remember, the amygdala's role is to protect you, and the amygdala and borderline always on the defensive, always alert, because they never had a soothing feeling, because they always in the war. They feel always like they are in dangerous situation. So their amygdala is in control. The PFC, the babysitter, is not able to control the amygdala, and they become always, they look at life in a very threatening and very stressful environment. The other problem we said in borderline is mentalization. So mentalization is the ability to understand other people's mind and feeling. And we said because they did not bond with their mother, borderline patient cannot understand other people's feeling, cannot convey the feeling of others and recognize it on their own. So borderline personalities have a lot of fear because they are unable to predict what's going to happen in the future and their loved one, or if you say anything, they might feel like you're gonna threaten to leave them. And the worst thing for borderline is being abandoned by anyone. These borderline will not be able to recognize the feeling of these facial expression. They cannot interrupt facial expression of other people. So they look at everybody like wearing kamama now. So if you wear the mask, you cannot, I see a lot of my friend in the hospital, but I don't know them because sometimes when they put the mask, I don't know them. So it's like borderline. Borderline cannot read anybody's face because they look at everyone like wearing a mask. So they cannot read their facial expression. They cannot read their ability to understand them, whether they are happy or not. So they feel threatened because they feel everybody is against them in that way. So what they have is what we call emotional dysregulation or affect dysregulation, where they always have a very stormy relation. very intense physiological reaction. They can explode anytime. If you see a word, they will become angry all the time, and they are unpredictable. They are self-harming. They have high-risk behavior, like they commit suicide all the time. I would try to commit suicide all the time. They have chronic suicidality all the time. They are chronically suicidal in that regard. طيب, and they are always run by the limbic brain. Limbic brain is the one that are running the show on these patients, not the cortex. So what pushed their button? How, most borderline will be fine for a long time, but they can, what you call it, flare up or have a feeling of anger, and they have what we call borderline storm or anger storm when you threaten to leave them. So any threatened attachment problem, they can be angry and trigger that button, or feel they are misunderstood. So if you misunderstand them, they become angry. They cannot read your emotion. So remember, you cannot soothe them because they cannot read that emotion of yours. So you always have to walk with them on eggshell all the time. Why they do self-harm? As we said, because it's increased the opiate receptor in the brain. So it will be self-soothing for them. It's like taking a shot of morphine. When they cut on their arm, it's like taking a shot of morphine where you feel relaxed and happy. And we have always to find a way to prevent suicide and try to teach them ways to cope and soothe themselves without being hurt and without killing themselves. So in crisis, we have always, when you see a borderline patient, if you decide to take her into your clinic, then you have to do always develop a crisis response. And you have to do boundary violations. So a crisis response, that you give them a number to call, tell them to call when they are suicidal, give them medication very judicially in a way that it will not make them abuse them, always assess the risk of suicide, always make a safety plan, always make liaison with the stakeholders who talk to her mother and father all the time. They have to be in control. Don't over involve with the patient, because the patient's borderline, they might invade on your boundary. So you have to be clear, like you can come to the clinic at this time only, and you can have this question, and you have to do rules for them, because immediately if you bend the rule, they will bend it completely. So you cannot tell her, if she tell you, I cannot, I can visit you at home, or let's go for a walk, you don't do that. I remember one of my student, I was his professor at the university back in America, and he was a fourth year resident in psychiatry. So he was about 2 months from finishing residency and being board certified in psychiatry, just a few months short of that. And apparently one of the borderline patient asked him, she told him that, the clinic is very busy and crowded, can we go for a walk in the park and let me explain to you my problems? So poor guy, he went with her to the park, and after that she had a crisis, and she accused him of doing something to her, and he was removed from the medical field, and all of his license, all of his medical school taken away from him, and he is selling hamburger at McDonald's now. No, I'm just kidding, I don't know where he is now, but they took away all of his license because of that. So you cannot do anything with the borderline. You cannot visit them at home. They cannot visit you at home. They cannot drive with you. They cannot do anything. You have to be very strict in the boundary when you deal with borderline. A treatment with medication might work. So you give them an antidepressant, might be a good idea, because the amygdala, remember, is very hyper, and SSRIs tend to tone down the amygdala. They have two new things that might help. Oxytocin, they are developing now. It's still in the trial. Oxytocin, most borderline don't have any oxytocin in their blood, or their oxytocin is low. Remember, oxytocin you get when you have like somebody who love you, and somebody who care about you, somebody who send you flower and say good things to you. So this is where increased oxytocin. Borderline had very, very low oxytocin. The guy who used to study oxytocin is named Mike George, And Mike George used to go measure oxytocin in patient. The problem with oxytocin, it has very short half-life. So you have, like, he take the machine with him on the spot. He go to a wedding. The wedding is where most people have very high oxytocin. So he will take the blood from people in the wedding and measure the oxytocin in their blood. And he found out the oxytocin will be very high in the bride, in the wife to be. So she will have the highest oxytocin. But the second highest is not in the husband, it's in the mother of the wife, who had very high oxytocin also. The husband does not have any oxytocin apparently for some reason. We don't have a lot of feeling. I'm just kidding. Okay, so flexible limit setting, you have to be very, very careful in dealing with them. Boundary violation is an issue because they will immediately violate the boundaries. We have to be very black and white with them, no's and yes, and what is permissible and what is not. um, the best treatment for borderline, this always come in the exam, in every exam, is called dialectical behavioral therapy. It's done by Marsha Lanahan in Washington. This is Marsha Lanahan is the mother of borderline. She teach patient how to deal with the stress, to deal with impulsiveness, to deal with mood liability, and teach her like what her mother did not teach her, how to regulate the emotion and how to be able to deal with behavior and relation and self-image. So if you want to read about it, it's very good. There's a lot of book you can read about it. Just put the name Marsha Lanahan. There's a book, I want you to read it in the summer.